Hey everyone, and welcome to Bioscan Hub. If you're a medical lab student, or you're just totally fascinated by the incredible science happening inside our bodies, then you've come to the right place. Today, we are taking a deep dive into the white blood cell count. This is a true cornerstone of any complete blood count, and we're going to go way beyond just the numbers. We'll explore what they really mean, we'll meet the key players in our immune army, and you'll learn how to interpret them like a clinical detective.
So, if that sounds good to you, do me a favor and hit that subscribe button. It really helps support our work and keeps you in the loop for all our new explainers. All right, let's get into it.
So here's our game plan for today. We're going to start with the absolute basics. What even is a WBC count? Then we'll introduce the two main families of these amazing cells. After that, we'll get to know each type one by one, learn how to decode that super important differential count, and then, the best part, putting it all together to see what these results actually mean for a patient. Okay, let's jump right into section 1. What exactly is a white blood cell count? And what kind of story is it trying to tell us about what's going on inside the body? Okay, so white blood cells, or as you'll properly know them, leukocytes, are literally the soldiers of our body's defense system. Their main mission? To seek and destroy. They combat infections and protect us from any and all foreign invaders. And they do this mainly through a process called phagocytosis, which is just a cool way of saying they literally engulf and digest things like bacteria. They're also responsible for producing the antibodies that are so essential to our immune response. Now, what's really fascinating is just how much the normal range for these cells can change depending on age. For an adult, a normal count is somewhere between 4,500 and 10,500. But just look at newborns. Their count can go all the way up to 30,000. So why the huge difference? Well, think about it. Their brand new immune systems are being hit with a whole world of new germs for the very first time. This massive army is their initial, powerful response. It's a perfect reminder that context, especially age, is absolutely everything when you're looking at lab results. When a WBC count goes off the normal path, it usually goes one of two ways. If it's too high, a condition we call leukocytosis, it's often a sign that the body is fighting something off. That could be an acute bacterial infection, some kind of inflammation, or trauma. In some cases, it can also be a sign of leukemia. On the flip side, if the count is too low, and that's called leukopenia, it might suggest a viral infection is underway, or maybe that the bone marrow itself is suppressed, which can happen with certain medications or treatments. But, there are levels of low, and then there's critically low. A white blood cell count that drops below 500 cells per cubic millimeter, that is an extremely dangerous clinical value, a real red flag. And this slide right here really drives home why that number is so terrifying. As the source material bluntly puts it, this condition, agranulocytosis, is often fatal. And the reason is starkly simple. The body is left completely defenseless. There just aren't enough soldiers left to fight back against invading agents. So we know the total number can signal there's a problem, but to really understand the story, we need to meet the individual soldiers. And you see, not all white blood cells are created equal. They're actually classified into two main families, the granulocytes and the agranulocytes. The key difference is pretty much right there in the name. Granulocytes, as you can see on the left, are packed with these distinctive little granules in their cytoplasm, and they have this kind of funky multi-lobed nucleus. This is why you'll sometimes hear that mouthful of a name, Polymorphonuclear leukocytes, or just PMNs for short. This group includes our friends the Neutrophils, Eosinophils, and Basophils. Now, in contrast, agranulocytes don't have those obvious granules, and they have a simpler, non-lobular nucleus, which earns them the name mononuclear leukocytes. This family is made up of lymphocytes and monocytes. All right, let's dive into that first family and meet the granular defense force, starting with the most common and, you could argue, the most important type. Meet the neutrophils. These guys are your body's first responders. They are, by far, the most numerous type of white blood cell, and they act as the frontline infantry in the war against microbial invasion, especially when it comes to bacterial infections. They literally rush to the site of trouble and immediately start engulfing the invaders. Okay, now here's a really crucial concept you've got to know, the neutrophil shift. So imagine a major infection is like a huge battle. The body sends out its mature, experienced neutrophils first. But if that battle gets really fierce, the bone marrow gets an urgent SOS message, like, send reinforcements now. A shift to the left is what happens when the marrow starts pushing out younger, immature neutrophils, we call them bands, before they're even fully trained. Now, if you see a lot of these bands, along with a high total WBC count, that's a regenerative shift. And that's actually a great sign. it means the body is putting up a powerful defense. But if you see a flood of these young bands without a rise in the total count, that's a degenerative shift, and that's a bad sign. It suggests the bone marrow is getting overwhelmed and just can't keep up. A shift to the right is less common. It involves older, hypersegmented neutrophils and can point towards things like liver disease or certain vitamin deficiencies. The other two granulocytes are a bit more specialized. You've got eosinophils, which are your go-to cells for fighting off allergic reactions and nasty parasitic infections. And then there are basophils, the rarest of the bunch, but they're also key players in allergic responses. Their granules are packed with things like histamine and heparin, which they release during inflammatory events. All right, let's turn our attention to the other family now, the agranulocytes. These are highly specialized cells that take on more of the complex, long-term functions of our immune system. First up, we have the lymphocytes. These are the brains and the memory of your immune system. They come in two main flavors: B cells, which produce antibodies and create a memory of past infections so you don't get sick from the same thing twice. And then you have T cells, which manage the direct, hand-to-hand cellular immune response. So when you're battling a virus like the flu or mono, you'll often see a big spike in your lymphocyte count. One type of T cell is so clinically important it gets its own spotlight: the CD4 helper T cell. Measuring the CD4 count is absolutely critical when you're managing patients with conditions that attack the immune system, like HIV. A count that drops below 200 is the single best predictor that the patient is at a very high risk for opportunistic infections, and it's what defines the progression to AIDS. And last but not least, we have the monocytes. The best way to think of them is as the battlefield cleanup crew. As the body's second line of defense, these are actually the largest of all the blood cells. After the neutrophils have fought the initial battle, the monocytes arrive to do this vital scavenger function. Through phagocytosis, they remove all the dead cells, microorganisms, and other debris, clearing the way so healing can actually begin. So we've met all the players. Now how do we actually see this breakdown on a lab report? This is where we learn to decode the differential count. And the absolute key here is understanding the difference between relative and absolute values. Okay, so a standard differential report is going to give you two crucial pieces of data. First, you get the relative count, which is just the percentage of each of the 5 leukocyte types. And second, you get the total WBC count. From those two numbers, we can then calculate the one that matters most, the absolute count. So this right here is the crucial takeaway, this simple formula. You take the relative percentage of a cell type and you multiply it by the total white blood cell count. That gives you the absolute number of that cell. So why is this so vital? Well, it's because percentages all by themselves can be dangerously misleading. A high percentage of one cell type might just mean another type has decreased in number. The absolute value, that's what tells you the real story of what's going on. All right, let's bring it all home. We're at our final and most important section, applying all this knowledge to actually interpret clinical results. And this quote right here, this is probably the single most important thing to take away from this entire explainer. The numbers on a lab report, they're just that. They're numbers. They are pretty much meaningless without context. A correct and useful interpretation is only possible when you connect those results directly to the patient's clinical condition, their symptoms, their history, the whole clinical picture. So we've gone from the very basics all the way to the subtleties of clinical interpretation. The differential count is so much more than just a list of numbers. It's a dynamic, living snapshot of the body's immune system in action. So I guess the real question is, now that you know how to read the numbers, what stories are you going to uncover in the next sample you look at?